Can prednisone make you feel crazy? Can taking steroids cause psychosis? Hi, I'm Dr. Megan, your prednisone pharmacist. I'm here because I received a phone call today from someone wondering if what they were feeling was from the prednisone or was it something else. So this person was given 5 days of prednisone. First, they were told to take 40 milligrams every day for 5 days. And instead of doing so, they took prednisone 40 milligrams for 3 days and then dropped down to 30 for 2 days and then did 20 for 1 day. So ended up getting 6 days of treatment. After a few days, felt totally unlike themselves. Terrible insomnia, couldn't sleep at all. Reports that for the last 10 days has hardly gotten any sleep. Gets jittery, shaky, and has had high blood pressure and is just feeling awful. He reports that he's got memory issues, a little bit of brain fog, and is desperate for help. If you're feeling any of those symptoms, then I am so sorry. It is just so hard and unpredictable. This is a side effect of prednisone that is unpredictable, and yet it is legitimately associated with steroids like prednisone. So what is this? Steroid psychosis, or corticosteroid induced psychosis, or prednisone psychosis, however you want to refer to it, is a side effect that can happen, and it actually has a legitimate diagnosis code in the Diagnostic and Statistical Manual number 5. That code is actually, to be precise, F19.251. And it's called Other Psychoactive Substance Dependence with Psychoactive Substance Induced Psychotic Disorder with Hallucinations. What a great diagnosis, right? And this steroid psychosis is life-changing for people. Being otherwise healthy, but needing just a few days of a steroid, whether it's an injection, it's usually a pill that people are taking. It's usually prednisone, but it could be methylprednisolone, which is Medrol. It could be hydrocortisone, could be dexamethasone. It's usually prednisone, though, that people are taking. And it's most common after 3 to 4 days of treatment. And then the diagnosis code specifically says, first, the patient must have at least delusions or hallucinations after exposure to a medication capable of producing these symptoms. So you can't have been having symptoms and then take the steroid and then they get worse. It has to be like you were otherwise healthy and then you took the steroid and then you're suddenly having symptoms. So it has to be timely, like there has to be a temporal relation between the symptoms and having taken the drug first. Okay, so the drug has to be first. Second, this disturbance cannot be better explained by a non-medication induced psychotic disorder, and it does not occur exclusively during the course of a delirium. So what that one is saying is it can't be caused by something else. Okay, it can't be caused by high blood sugar or diabetes or kidney problems or some other thing that's causing the balance in your body to be out of whack. It has to be, the only other option left is that you were exposed to a drug. So if you are concerned that this is the problem you're having, then your doctor needs to rule out all other possibilities first before deciding that this is the only option left. So that was number 2. And number 3, finally, it must cause clinically significant distress or functional impairment. So basically, it can't just be the hypomania that people commonly experience with prednisone. That's where you feel really good, just like life is great. I've got plenty of energy. I can do anything. My neighbor, he said, I was able to power wash my my camper trailer. He's like in his 80s and he was power washing his camper trailer. Like, this is great. I've got so much energy and I'm back to, being young again. That's hypomania. This has to cause distress or functional impairment. You have to be unable to function. Okay. So it's hypomania is where it's like difference, but it's not causing a problem. Whereas mania, psychosis, these other mental illness complications of prednisone, They have to cause a problem in your life. Okay. So then what are the possible complications to go along with steroid psychosis? So the complications could be depression. So you might have this brain fog and fatigue and anxiety and stuff, but there's depression that goes along with it, can happen. Hypomania, I've already mentioned. Mania is where you're really feeling disconnected and excited, possibly having pressure to do something. Psychotic disorders is where you're feeling like completely disconnected from reality in some way, whether you're believing something that isn't true. Like, for example, one woman in this case series that the scientific article, she believed she was pregnant and they had done pregnancy tests. She was not actually factually pregnant. And so it's believing things that aren't true, being suspicious of people, paranoid delusions, those are possible. Complications, cognitive impairment. So just brain fog, just like I can't remember well, delirium, just kind of that feverish, like I'm not quite there. And dementia is where there's full-blown memory loss, inability to quite remember what's going on, what's happened recently or even in the distant past. So those are complications that can happen. Then when does this happen? When is it most likely to happen? When a person is taking steroids. And according to the study, it says steroid psychosis happens shortly after administering steroids, typically a medium of 3 to 4 days, but it can occur at any time during therapy or even after treatment discontinuation. So what that's saying is it's usually within the first few days of treatment, but it can happen anytime. It could happen after a year. It could happen after you've taken it successfully in the past, taken it, tapered off, years go by, taking it, taping off, years go by, and then suddenly it's happening this time. There's no way to like definitely predict that it's going to happen unless you've had it happen in the past. Then it is somewhat predictive. And then it can happen even after you stop taking the steroids. You could have stopped taking the prednisone 5 days ago and then suddenly have these symptoms. That is possible as well. So then it's happening. I know it's happening. I know when it's happening. What can I do about it? Right? That's your next question. And so the treatment, the number one most effective treatment is to taper off the steroids or discontinue their use. Otherwise, the quickest taper that you can tolerate, if you're taking it for a life-threatening condition, then there's a definite risk balance question you and your doctor and your team have to go through. I am not capable of making that kind of decision on your behalf. I am not your doctor. And you have to be working with your doctor closely to determine whether or not to go off steroids, to go off prednisone. That is 100% a conversation you have to have with your doctor, because going off suddenly can be fatal. So you can't just stop taking it without consulting a medical authority who knows your situation. Okay. So that's the most effective treatment under your doctor's care. Okay. Second is giving an antipsychotic medication. This is a steroid psychosis situation. So an antipsychotic makes sense. And there are different kinds of antipsychotics. They recommend that there's the second generation antipsychotics like haloperidol. And then there's, that was a first generation antipsychotic is haloperidol. And then the second generation antipsychotics are risperidone, like Risperdal, olanzapine, and quetiapine. So those are second generation antipsychotics that can help with the psychosis. And then if the symptoms are more into the mania side, then lithium can help. And if the symptoms are more depressive, then SSRI, which is selective serotonin reuptake inhibitors, can help. So those are possible treatments. There are other medications that can support other symptoms. I don't want to go deep into that because that's really what your doctor, your mental health team will need. If you are going through this, this is a very serious complication of taking steroids. And I encourage you to get help from a qualified mental health professional. That means possibly going to the emergency room. They may not be able to support you there. If not, checking yourself into a hospital, into a psych unit, behavioral health unit. People who have these symptoms are also at risk for suicide. And so if you are having this, I urge you to get the help you need. I do not want anyone suffering this. I've received emails and phone calls from people who have lost family members to suicide after taking prednisone. And I never want that to happen. It is treatable. We can get you the help you need. You do not need to suffer. Call 211 in the United States. They can help you. There are a lot of other resources I'm going to link to below that you can go to. There are support phone calls, there are support websites that you can use to get you through this hard time. And the most important thing I want you to understand is that the first diagnosis qualification was it was because of the drug, and then you had the symptoms. Okay. It's not you. It's the drug causing this. Okay. It's a side effect. You don't need to feel like you're going crazy. You're not. It's a side effect of a drug, and you need to get the treatment for this side effect. It's terrible that taking a life-saving medication like prednisone can cause such a life-threatening complication, such as steroid psychosis. But that's the paradox of prednisone, that the good comes with the bad. It's a two-edged sword. And so I urge you to get the help you need. And if you need support in the form of other people who've gone through this, I have several prednisone warriors who've reached out to me, told me their story. And in fact, I've interviewed the author of a book about this topic called Steroids Stole My Summer. And you should watch that. It's a fantastic interview, and what he recommends in that book is fantastic. So he can dive deeper into understanding what it feels like. So check out those resources and get the help you need. Signing off as Dr. Megan, your prednisone pharmacist.